You're listening to a brief excerpt from Social Determinants of Health, Turning Potential into Actual Value, sponsored by LexisNexis Healthcare, with Aaron Benson, Director Market Planning, and Rich Marino, Director Strategic Solutions. This webinar discusses elements of success for social determinants of health and opportunities for health plans to leverage social determinants of health data to attain quality goals while managing cost and enhancing member experience.
Specifically this afternoon, we want to cover two key objectives. First, we'll examine what is needed to deliver success with social determinants of health. This will include debunking common myths about socioeconomic data and revealing the truth about requiring correlation to health outcomes. We'll also look at previous generations of social determinants of health and what is required for success. Our second objective is we will discuss how social determinants of health innovation can impact quality goals while reducing costs and improving member experience. To do this, we'll look at examples of ways social determinants can enhance predictions as well as impact care coordination. We'll also address the importance of identifying combinations of socioeconomic factors in assessing member risk. A scenario will help bring the discussion to life so you can see how the socioeconomic data can enhance your workflows.
Now before you see all 5 categories of social determinants of health, and I want to spend a moment talking about these because what we've articulated here so far is it's critical that you get data that spans all 5 categories. So here's some example information that can be gleaned from these different categories. As a reminder, as Aaron alluded to earlier, you don't want to look only at this one ingredient per case. You want to aggregate them in total to get a better picture. But if we do look at these individual ingredients and how we bake that cake, an example under economic stability might be address stability. There's a high correlation between members with a high number of addresses in the last 60 months and the use of the emergency room. Now, this makes sense actually, because if you're more worried about having a roof over your head, you're probably not focused on your health or probably don't have the financial resources to visit a primary care physician. We've also seen under economic stability professional licenses being something quite valuable. Members who have family members with a professional license, anything from lawyers to plumbers, are more likely to finish an intervention program and stay motivated, as research has shown. If we move over to education, it's critical that we have an understanding of the level of education of the people we're engaging with to make sure that our communication with them is written or scripted at the appropriate level. Health and healthcare is quite obvious. Do they have access to care where they live? Neighborhood built environment. Do they live in a high crime neighborhood, which would make exercise outside an impossible feat in an intervention program? Another aspect is whether or not they're taking a look at their income index. For instance, has their income precipitously fallen recently, indicating that they could be under stress, which exacerbates comorbidities. And finally, if we look at social and community context, we could glean information such as crimes. You could look at parent and guardian and see if they've been involved in any crimes previously to try and make predictions around adverse child experiences that might lead to future negative outcomes. We also see a strong correlation between registered voters and people being motivated to participate in an intervention program to its completion.
You've been listening to a brief excerpt from the Social Determinants of Health, Turning Potential into Actual Value webinar, sponsored by LexisNexis Healthcare, recorded on April 18th. The full interactive webinar with audience polling and Q&A discussions explores the myths and truths associated with social determinants of health data, offers examples of how the right data correlates to health outcomes, and the importance of identifying combinations of socioeconomic factors in assessing member risk. You'll want to be sure to watch the full 1-hour webinar video, now available on YouTube, at the link indicated on your screen.